Alrighty, welcome everyone to the Allied Health Internship Program informational session. My name's Crystal Torres. I'm the project specialist here at CCALAC, and I'm super excited to let you know more about the Allied Health Internship Program that we host, and hopefully, I can get folks to apply at the end of this informational session. So, welcome. So I did an introductions. Feel free to say hello on the chat. Since it is a smaller group, feel free to unmute yourself if you have any questions throughout the presentation, but we will have questions at the end. But before we get into the questions about the program, I'm going to start with an overview of CCLAC, a program overview and timeline, as well as the application process and requirements and program expectations. All right, a quick overview of CCLAC. Who are we? So, CCLAC is a nonprofit organization that represents 65 member health centers all over LA area. So, we have been around for 30 years. As you can see from our logo, we're celebrating our 30-year anniversary, and we provide resources and programs that help our health centers better serve their patient populations. And our member health centers are located all over LA County. They provide primary health care, medical, dental, mental health services to uninsured, underinsured, and under-resourced populations. And there's over 300 clinical service delivery sites, and they serve 1.7 million patients annually. And I'm not going to read our mission or vision, but really one of our missions is really to promote community health centers within our area. And one ways we do that is through our pipeline programs, which I'll go more in depth with. But before I go into that, I kind of wanted to talk about our CCLAC's anti-racist organizational change initiative. So in the summer of 2020, at midst of the protests that were going around in 2020, CCLAC strives to be an anti-racist organization, and is looking to make it a culture that's equitable, inclusive, and supportive for all of our employees and members. So we really try to use the justice, equity, diversity, and inclusion lens in the work that we do, in order to really promote more equitable an equitable healthcare system. So we really try to be intentional in the way we build our curriculums as well as recruit folks. So we really want to make sure we touch upon of these structures in order to be more anti-racist in our organization infrastructure. So just wanted to put that out there. And with that said, I kind of wanted to kind of give you a glimpse of all of the health centers that are part of our membership, and so y'all can see who they serve. So I'm gonna play this video.
It's one thing to be part of your community, it's another thing to be part of it and being and serving it, giving back.
I always knew I wanted to work in a clinic setting. I did a comparison and I felt like my services were just better provided here at a clinic setting versus a private office.
Being a part of this community health center really helps us to serve Angelenos and their healthcare needs.
One of the reasons that I continue to work here is because everyone who shows up to work here believes in the mission, and it's palpable.
It's wonderful to work with a great group of other providers and be able to share stories and ask questions and learn from each other.
Being able to help people that are in positions where they need help is pretty rewarding.
My favorite aspect about my role is helping patients get better, how they improve, and hopefully try to cheer them up.
I love how passionate everyone is here, really passionate about giving quality health care to everyone.
Umma represents community in Arabic, but the root word of Umma is which is mother. And that represents, like, what do you feel when you see mother? You say, oh, it's nurturing, it's loving. And knowing that that is a part of what Umma is about is something that, I'm about.
Being here, we're able to provide the access to care that all our patients need. not only our adult population, our pediatric population, and our elderly population. And I feel that patients have the comfort knowing that, okay, I have a center I can go to.
You know that the people actually really care about their patients and their community. And a lot of the people who work here are from this community.
This is my first job in the medical field. I had other jobs before, but working here has improved my work ethic and skills.
I work here at Queen's Care because I have a passion for helping patients.
We are a non-profit organization. Our main goal is for helping others.
My calling is what wakes me up every morning to be here and serve our community and our patients. And then I think seeing the strength of those around me.
And I want the children of this area who look like me to see that they can reach whatever dream that they have. And I think if they can come into a clinic and see someone who looks like them, who is in these positions, it motivates them.
As you can see from the video, a lot of the patient populations that our health centers serve are diverse patient populations from low income neighborhoods. So a lot of folks really need these health centers in their community. And as you can see, a lot of folks who work in community health centers are very community oriented. And it gave you kind of a glimpse of the type of all of the health centers around the LA area that you might be familiar with. I'm not sure. Feel free to write in the chat if any of those health centers or logos kind of look familiar to you or are around your neighborhood. And this slide also showcases how they're all over LA County. We have health center sites from Palmdale, Antelope Valley area to San Gabriel Valley to San Fernando Valley to LA, as well as up to Torrance and Long Beach. So our health center sites are literally located everywhere. And as I mentioned, CCALAC really provides our health centers with a bunch of resources. We provided a lot of resources during COVID-19, as well as resources with our roundtables and peer networks that promote peer learning between each health center, and our workforce pipeline programs, which I'm going to go more into detail with the allied health and much more. We provide trainings for our health centers, so we provide an array of services to our health centers. But today I'm going to talk about allied health. Alrighty, so the Allied Health Internship Program. Now that you know more about who we are, let me tell you about the program. So the program is sponsored this year by Kaiser, California AHEC, and Cedar Sinai. And it's a program that is really geared to help folks kick off their career in community health. So I wanted to highlight these numbers of last year. So last year was actually the first year we launched this program, and it was a success. We had 26 interns participate in our program last year. And out of those 26, there are medical assistants, phlebotomists, billing and coding folks, pre-med folks, pre-nursing, and community health workers. And we had 12 participating health centers that participated. And out of the 26, 9 of them received job offers and 7 accepted the job offers. And those type of job offers were lead care manager, medical assistants, community outreach worker, building clerk, and patient care coordinator. So as you can see, we did have a diverse array of allied health professionals participate in our program last year, and this is a lovely picture of them with their certificate at the end. So many of them did share testimonials that they really found this program beneficial to really kick off their career, as well as gain that experience needed to work in community health or really know that their passion is within the healthcare system. And I just wanted to showcase all of the participating health centers from last year's program that participated and hosted an intern. We had Clínica Romero, Los Angeles Christian Health Centers, Herald Christian Health Centers, White Memorial, San Fernando Community Health Center, THE Health and Wellness Center, CHAP Care, Center for Family Health and Education, Via Care, CUR, VHS, and JWCH Institute participate. So I'm not sure these logos look familiar, but feel free to write in the chat. I want to make sure it's engaging. This webinar is engaging as possible, and let me know if any of these health centers are near your neighborhood or you've seen them before. But yeah, these were the ones that participated last year. So our program overarching goals, we really are trying to discover the next generation of allied health professionals, and we also want to invest in their potential and growth. So as you know, this program is geared for recent or about to graduate allied health professionals that really want to kick off their career. And we really want to expose them to the community health world and expose them to the possibilities of really launching your career within community health. And we also want to train our interns by providing them with workshops that are going to be essential for their professional development and really become leaders within their field of work. And also connect them. I think it's important to connect you all with other allied health professions and also promote mentorship within the program. And also peer networking. I think that's super beneficial since you all are in a similar career pathway. And again, the goal of the program is for you to potentially get hired. We're looking for folks who are qualified candidates that can really meet the health center workforce needs. So we want y'all to be ready to be hired at the end of the program, hopefully. So those are the goals within the program. And as you can see, this year we're looking for 40 allied health interns or professionals to participate in a paid 100-hour in-person internship at one of our member health centers sites. And the program will begin in late spring, early summer. And then prior to the internship, folks are going to participate in 3 virtual workshops. And throughout the internship, we'll also be given gift card incentives in order to keep y'all engaged. And at the end, hopefully, you potentially get a job offer and you receive a certificate of completion. And also, a perk that I would like to add, many folks who participated in this program, a perk that did come up is many of them got letters of recommendations for whatever program or whatever, if they're going to school next to complete, I don't know, whatever certificate. That's also a perk within this program that came up from last year, which I thought was lovely. So as you can see, we're looking for a diverse group of folks and allied health professionals from medical assistants, LVNs, farm tech, health information technology folks, billing and coding folks, dental assistants, dental hygienists, phlebotomists, community health workers, promotoras, substance abuse counselors, patient care representatives, navigators, and care coordinators, as well administrative folks with customer service, reception, and call center skills, or undergraduate majors interested in community health or have this type of degree within social work, health education, and health administration. So yeah, we're looking for a diverse group of folks, and I know many folks probably have 2 types of tracks that they're probably in or certificates that they have in. That's better. That makes you a stronger candidate. So yeah, as long as you are in one of these areas of study, you qualify and are eligible to be part of the program. If you are in one of these areas of study. And the requirements is for you to complete and submit an application, at least be 18 years or old, attend the 2 virtual workshops plus orientation, ability to complete 100 hours in-person internship at the health center site. And then your availability is either through Monday through Friday. If you're bilingual, that's a plus, especially if it's Spanish. Put it in your application. I highly recommend it. And then must be able to do the internship between the hours 8 to 5 because those are the hours that our health centers are open, and live in LA County because, again, the goal of this program is for you to potentially get hired and have reliable transportation, as well as must be in the last 4 to 6 months of your program. So you're either graduating in May or you already graduated, you already certified with whatever allied health profession. And I think a question came in. So would a degree in sociology or in global health and policy would count? Hi Elizabeth, great question. So if you're getting your bachelor degree and you're graduating this year and your area of study doesn't are not like the ones listed on our website, that's totally fine as long as you express it in your personal insight questions why you're interested in community health and like what's your interest in healthcare. So that's literally you would qualify if you're graduating this year. I hope that answers your question. And then another one came in. So Elisha said, I do not live in LA County but would be willing to commute. Would I still be able to apply? Fortunately, no, because our program is within LA County. So not you don't you could live in like the other I mean LA County, which that includes the Antelope Valley, San Gabriel Valley, San Fernando Valley, all of the Torrance area. That if you live in those areas, that's fine. But if you do not, if you live like in the Inland Empire, unfortunately, you won't qualify for the program just because that commute is always like a big factor when folks are gonna receive like a job offer. I hope that answers your question. Okay, awesome. And then Catherine Cueva asked, I just submitted my application for my license is pending and was told can take 60 days. Is that okay? Yes. So if you're gonna, I did get your application, but if you're graduating this year, you qualify. As long as you're graduating, I think I have the due date, before May 26th, I think, or as long as you're graduating before before August 2024 of this year. Sorry, I forget what year we're in. But yeah, as long as you're graduating before then. Okay, you already graduated, then you're good. Okay, any other questions? I like the questions. I want to be engaging. Alrighty. If no questions, I'm moving forward, but again, feel free to ask questions in the chat or unmute yourself. I don't mind. Alrighty, so other potential requirements for health centers. So this is a heads up. So the COVID-19 vaccine and proof of vaccination is required. Many of our health centers, because you are working in a healthcare setting, this is like an expectation to have your COVID-19 shot. And due to the nature of the roles and your access and interactions with various patient population, the clinic sites may likely ask you for a TB test, physical and or immunization records. So I like thinking about it if y'all ever volunteered anywhere, they always, especially at a healthcare setting, basically you're gonna do all that type of paperwork, which will ask you for a proof of vaccination, maybe a TB test. So those are the things that our health centers will probably require you to do, as well as pass through a background check. But again, there can be other requirements because each health center has their own rules, but those are like the most popular requirements from last year. But again, you'll know that information once you are matched. But these are some potential requirements that you should keep on your radar when applying to the program. Alrighty, so intern benefits. So the the benefits for being part of this program is really the opportunity to get paid to gain experience within the field you're studying in. So you get paid $1,500 total at the end of the program for completing 100 hours at the internship site, and those are in person. And throughout the program, we also provide gift card incentives. And these gift card incentives are $25 Visa gift cards. So they're gift cards you can use for anything really. So the first ones that we provide are for attending the workshops. You get $25 gift cards for those, which that would total for $50 because you get a gift card for workshop number 1 and number 2. Another gift card incentive is for submitting your timesheet. So the way we submit, the way you receive your gift cards is basically you have to meet certain hours, and then based on that, you'll get your $25 gift card at the start of your internship, $50 gift card at the midway point, and a $100 gift card at the end. So that's a total of 175. So I like adding the gift card incentive to like the stipend because the gift cards are again Visa gift cards, which you can use for anything. And then and it's a way also to keep you engaged and motivated to complete the program. And you have an opportunity to learn about community health centers. Not many people know about community health centers and the type of careers that are within community health, and how it can be super beneficial because it's a more intimate setting and you're really gaining a lot of hands-on experience, which I think a lot of folks are looking for, and also an opportunity to be hired after the program. So we really want folks to be, again, ready to work at the end. And that's the goal of the programs, for you to be a strong candidate. And I like saying to folks to treat it like a long interview process. You're getting to know the health center, and the health center is getting to know you. So try to make it as a positive experience as possible, and try to get as much experience as possible too, because it is, again, for your own professional growth and development within your career pathway. And then at the end, you get a certificate awarded at the program ceremony, and it's a lovely ceremony that we have at our offices. We all look nice and eat great food, so it's always fun to see everyone in person all together. So that's the benefits for being part of the program. Alrighty, so I'm going to the next part, which is the Allied Health Internship Program application. I'm double checking if there's any questions. Were all job offers after program completion full-time positions? Yes, there were full-time positions, but there's also potential for part-time positions. Again, that's a discussion that you would be having with your health center, and throughout the workshops that we conduct, we're basically going to try to prepare you to have those conversations with your health center, like during your check-ins with your preceptor. Yeah, awesome. Thank you. But yeah, alrighty. Allied Health Internship Program application. So our application is fairly simple. It consists of 5 sections. It's program eligibility. So it's going to ask you a series of questions, yes or no questions to be exact. Basically to know if you qualify for the program. If you answer no to any, you most likely don't qualify for the program. But if there is an issue or anything, feel free to reach out to me if you need clarity. But that's the first section. The second section is demographic questions. So it's just basically questions about your name, your address, your ethnicity, and so forth. And then the third section is the area of study. So I'm going to be asking questions about what career pathway you are in. So if you're a medical assistant, a phlebotomist, a biller and coder, you have to put that information, as well as what school you're in and when are you graduating. So those are the type of questions that are in the area of studies questions. And then the next one is the personal insight questions. So this one is a chance for you to tell me why you're interested in the program and why you're interested in community health. So the first question is asking, why do you want to work in community health? So please write a meaningful response. At least a minimum of 5 sentences for that question, as well as to tell us about your experience working with diverse populations in a community setting. Please, again, write a meaningful response, minimum of 5 sentences for that one as well. It just helps me know why you're interested in the program. And then the last section is your resume and unofficial transcript document upload. So, or a proof of your certificate if you already have it. So it's just for me to make sure that you are certified in the area of study that you selected, as well as for me to gain more insight of your experience by uploading your resume. Try to upload your most up-to-date resume, because that would help me during the matching process as well. And the deadline to submit your application is on March 22nd, 2024 at 11:59 p.m. And this is the link. Oh, I forgot to mention the slide deck and everything I'm saying, all the recording will be shared to you all after. But this is a link to the application, and this is how it would look like. I don't think we have time to like go through it, but if we do at the end, I can do that as well. But I'm gonna just move forward. But is there any questions regarding the application so far? No? Okay. I'm gonna move forward. So now the Allied Health Internship Program timeline. Alrighty, so this is probably what y'all were waiting for. So the timeline. So as you may know, the application is currently open. Um, it opened on January 29 this year, and it's gonna close on March 22nd. So try to apply as soon as you can. The sooner the better, because the way I do interviews is on a rolling basis. So applicant interviews have already been conducted this week. So I'll be interviewing folks from February to mid-April. The reason why it's mid-April is because the what do you call it? The deadline's March 22nd. So I want to make sure I interview everyone that is a great candidate for the program. So during the week of April 15, that's when you acceptance letters will be sent. So you're either going to get an acceptance letter, a waitlist letter, or a letter of rejection. But again, that's the week of April 15. So the folks that I did interview early, um, please keep calm. I will get back to you, but it will be around the week of April 18th. And then once I sent you those acceptance letters. Those acceptance letters would have a due date of when you can accept the offer if you're going to be part of the program, just so I know. If you still want to follow through for the program, and if let's say you can or you do, those on the wait list will then get an acceptance letter. So that's how it's going to go down this year. And after, once folks are accepted to the program, we'll then be invited to the mandatory program orientation, where we'll go more in detail with the logistics of the program and also the paperwork and expectations, as well as know their matching. And that happens on May 9th, from 6 to 8. And that happens virtually via Zoom. I think a question came in. Let me double check. Is priority given to early applicants? Is there an advantage to applying and interviewing early? I would say yes. There is an advantage to interviewing early, just because I get to know the person and already have like, oh, this person's a good candidate. So I highly recommend to apply early if you know this is a program you're interested in. But again, I will be interviewing all qualified candidates, just to see like who is a strong candidate for the program. But I would say interview early. That's always my suggestion, or like complete the application early. Um, are we gonna? So I got a message. Are we gonna receive in our email on how to make a submission for application? Oh, I will send you a follow-up email with the link to the application, as well as the link to these slides and the recording. I hope that answers your question.
Yes.
Okay, perfect. Yeah. And then the next item I was gonna say, workshops. So the workshop, so after orientation, so the next so this happens on Thursday evening from 6 to 8 via Zoom. The next workshop would be on May 16 from 6 to 8. And then this next workshop is May 23rd from 6 to 8. And again, these workshops are via Zoom. We want to make sure they're accessible for folks, but they're mandatory for folks to attend. And it's a great opportunity to connect to your cohort during these workshops. We always try to have fun and have a good curriculum for y'all before you start your internship hours. And these workshops are geared to really equip you to be a successful intern at the health center site. And I thought a question came in, sorry. And then the next thing after that, your internship hours begin the week of May 27, 2024. So what that means, you should be getting connected already with your health center by that time to have a start date. I know many of y'all will probably have different start dates depending on your graduation date, which is totally fine. But the only caveat is that you must complete all of your internship hours by the July 31st deadline. So you could start a little bit later, like let's say if you graduate in June and you want to start in June, that's totally fine, but you must complete your hours by July 31st. And then you also need to be already in communication with your health center by the week of May 27. That's why that's there. I hope that makes sense. I don't think I've said this, but the minimum hours per week to work at your health center site is 10 hours minimum and 25 hours maximum. So if you do the minimum route, that gives you 10 weeks to complete your internship hours. If you do the maximum route, that gives you a month to complete your internship hours. So that's something to keep in mind. We're trying our best to be flexible because we know sometimes you have other commitments, but we really want to make sure that um, you are able to complete the program on time. And again, the energy you put into your internship hours is the energy you'll get back. So I think there's a question, Catherine.
Yes, hi, good evening. I did have a question. Our internship hours, are they going to be booked by the clinics, wherever we get sent to? Do they book us or we have to be on top of that? Or I just want to know if we're going to be fighting with other, internship programs.
Oh, so the way I do it during orientation, you will get more information on the matching process with the health center, and basically that's a conversation. I would then give the contact information to your to the designated health center, and basically the health center would invite you to come fill out the paperwork, and you have that conversation of what your hours would look like. So for example, if you say, I cannot work Monday and Wednesday because I have, I don't know, a part-time job or something, you have to figure out what days, like I can come Tuesdays and Thursdays for, so like, let's say for 4 hours Tuesdays and 8 hours Thursdays, that can work out. So that gets discussed with your health center. But once you're matched with one health center, you're with that health center. You're not fighting for like health centers. I get to match folks based on the health center's needs and requests, as well as the intern's location. So I try to match you based on the proximity that you are within that health center. So I'm not gonna, like, let's say if you live in South Central LA, I'm not gonna place you somewhere in the San Fernando Valley or something. So I hope that makes sense. Did that answer your question, Catherine?
Yes, it did. Thank you so much.
Awesome. Thank you. Great questions, by the way. Okay, perfect. So yeah, and then the program graduation ceremony is when folks should be able to receive their stipend. So it would be on August 8th at our offices. So the way we're gonna distribute stipends is in graduation. So that's just something to keep in mind. You don't get paid right away. You get paid like after everyone kind of finishes. That's why I gave the July 31st deadline, so folks know that right after July 31st they should start getting their stipend before their graduation ceremony. So hopefully that makes sense. Alrighty. Next question is program requirements and expectations. So again, as I mentioned, you must attend and engage in all virtual didactic workshops. And again, these workshops are really meant for your personal growth and for you to connect with your cohort members. So we want folks to be curious, respectful, and present throughout these workshops. We really try to make them engaging for folks to talk to one another and have breakout sessions. We also want folks to listen actively, promote respect, encourage open dialogue, and embrace vulnerability. Because again, many of the people in this program don't have as much as experience and they want to gain that. So it helps, creating that safe space where folks can kind of be like, oh, this is what I'll do. So our workshops are very engaging throughout. And also we want folks to invest in their professional development that will benefit their career pathway. And again, a way to connect with your cohort, because these people can, you guys are all in similar career pathways. Some folks are like pre-med, pre-health. You guys probably have similar goals, and I think it's important to help one another. So I really want folks to engage throughout the workshops, must complete their 100-hour in-person internship experience at their respective health center site. So as I said prior, it's 10 hours per week minimum, 25 hours per week maximum, and we really want folks to optimize their experience. Again, if you are the person to take initiative, is trying to problem solve, like really put yourself out there, because again, the goal of this program is to really get hired at the end, and also for you to gain experience of what it's like to work in community health. So I'm looking for folks who are really like ready to like you know um take initiative and be really utilize all the resources available within that healthcare setting. And again, but when I say that, it's really to engage with your supervisors, find mentors, and connect with peers. You will be having a designated preceptor, so treat that person as your mentor. That person can probably help you um, gain more experience or gain more insight in their field of work. Take initiative and again utilize all resources and opportunities to grow during your externship. The energy you put in is the energy you'll get throughout this internship. So I really want folks to put it their all in this internship because I think it's a great opportunity to really get your feet wet and really kick off your career within community health. And of course, communicate and complete required forms in a timely manner. So I'll be the designated person that will be in contact with you throughout the program. So if you have any questions, challenges, or concerns throughout your internship, I'm your point person, and I really want folks to have a positive experience. So yeah, feel free to communicate with me anything. I really try my best to make sure that you guys are in good hands and you guys are gaining good experience within these health centers. And of course, we want folks to complete evaluation and alumni surveys during and after graduating for the program. This just helps me improve the program for future cohorts. So yeah, those are the requirements and expectations. And I'm gonna just stop there if there's any questions. Okay, no questions. Alrighty. So, the other requirements that I kind of wanted to give insight, and again, you'll get more information about this during orientation if you get accepted into the program. So you must respond to the acceptance letter in a timely manner. So I will give you a due date with that acceptance letter. If I don't hear a response, I will automatically assume you're not interested, and then give an opportunity to whoever's on the wait list. And then program participants will also receive an orientation packet that will include, but not limited to, but um, a paper to sign a media release form, as well as a program agreement form, which will basically provide a more details information about the program logistics, and then complete a W-9 form. And that W-9 forms, you have to include your social security number, your work permit number, or an I-10, or complete an I-10 form if you're an international student. And then again, more information and guidance will be given during the mandatory orientation with what you need to complete. But just wanted to keep this wanted to showcase this in case folks had any questions on like what type of materials we would need you to complete in advance. So yeah. With that said, I highly recommend folks to apply now. Again, I highly recommend to apply early if you're able to, just so you can get a scheduled interview right away. Other than that, I guess now we're gonna head out to the Q&A, and this is my information. So contact information. So if you have any questions, feel free to reach out to me. I'm happy to respond and make sure you get the clarification you need. But with that said, I'm going to stop my screen so we can go into Q&A. So I think there were some questions. Oh, is the orientation online or in person? That's a great question. Orientation is online. The only thing that's going to be in person are your internship hours and the program ceremony. Is there any other questions? Now's the time.
I'm good on my end. Thank you.
Okay, perfect. I guess I'll just stop recording for now because maybe that makes folks shy.